Hi, my name is Trevor. I have been on YouTube for a while, but I stopped posting for many years in between. I'm 20 now. I am recording this on different setup than I previously recorded things on. I have a webcam setup, and I'm using OBS and stuff right now. I just found that easier because everything's connected to one spot. When I was doing YouTube previously, I had the jankiest setup. It was a point and shoot camera, and it was actually a really good camera. No shade to that at all. I still have it. I still use it for a lot of stuff. But it was a pain to record video on. And it was a pain because I also had a microphone, but the microphone couldn't hook up to the camera. And so I would end up having to shoot the video separate, the audio separate, and then sync everything up together on a different application on my computer. I'm hoping this streamlines a little bit of the process. So, anyway, I am here to talk about my experience. That's kind of what I was always on YouTube for. I wanted to share thoughts and ideas. I think that's the wonder of this platform, is just a community sharing ideas, sharing their stories, and kind of fitting them together into a picture that the whole world fits into, all of us. I think we all can learn something really valuable from hearing other people, just listening for a little bit, collaborating, bouncing ideas back off of. And that's kind of what I wanted to do too when I started YouTube, but I was really shit at it. Part of the reason I think I was particularly shit at YouTube is my personality. But in my older videos, it was very clearly, this is someone who is not used to being in front of the camera and is talking and acting very much like there's a camera present. And that's not my favorite YouTube video to watch, so I can see why it wouldn't be other people's favorite YouTube video to watch. Which is why today I am coming with a type of video I've never really made before. Once again, I took a long break, but now I'm coming back with different energy, I guess. And I want to just kind of sit down and talk. I want to chat about things. And I want it to feel more personal, more intimate, because that's personally what I like to watch. When I started my YouTube quote-unquote career, it wasn't really a career back then. I was a young teenager. I started my videos about trans people because I am a trans dude, and I was involved in the YouTube space at the time, watching other trans creators and trying to immerse myself with other queer creators, and I thought I could emulate that, and boy was I wrong. As much as I liked to think I was like super smart and like educated at the time, obviously I wasn't. I wasn't. I have more life experience now. I've settled into my transition more. I've settled into my identity more. And now I feel like I actually have a place to speak on it. I mean, at the time, I can't even say I fully knew myself. I still don't know myself, to be honest. But I know myself better, and I have more perspective now. So this video is going to be talking about something more specific. This is my transition story as a child. I started testosterone when I was 14, and I guess that's really surprising to a lot of people now. At the time, I was like, oh, this is normal. Because to me, I was going to all the doctor's appointments. I'm like, all right, this is just like any other medical appointment I might have. Looking back at it now as a 20-year-old and knowing more trans people now who have transitioned as adults, because not many people transition as kids, I feel like I have more to say about it. I have more to say about how transitioning so young impacted me. And unfortunately, the side of this is I don't know how it wouldn't have impacted me. Like, I don't know what it's like without the testosterone. I didn't have the experience having to wait until 16 or 18 to get on hormone replacement therapy. I don't know any experience that isn't my own. I know what it's like to be a trans kid. I know what it's like to go on testosterone at a young age. I don't know what it's like having to wait for that. Hi, this is Editing Trevor jumping in here. I had recorded a whole section of the video which gave some pretty important background that I use as jumping off points later in the video. But the initial recording I did for that was really messy, and it wasn't really coherent, so I'm just going to redo this part here. Essentially, in the original recording, I was talking about how I developed juvenile arthritis when I was 7. I got diagnosed about a year later when I was 8. This is important. It just kind of establishes my background as a patient already in the medical system. I was getting treated. I was familiar with being treated by different specialties of doctors, and all of that stuff. So rheumatology was, the main specialty I was already a part of, but there were still some doctors here and there that I also saw along the way. Let's just get into the meat and potatoes of this, because I don't really know where to start this. I have a few main things I want to keep in mind and reasons for talking about this. The biggest reason is, one, there is so much panic and discourse, specifically around trans kids and how we treat trans kids. Because trans people as a group, as much as we like to hate on them and say, oh, you're ugly and evil and demonic and all that, there's only so much you can do about the adults. There's only so much. They have free will, and I think most people in places of power know that they can't really do anything to stop adults from accessing hormone replacement therapy or surgeries. But because children are... I don't even know how to say this. Children are an easy target for bigots, because if we can use the, oh, it's for the kids argument, then like everyone herds behind them. So a lot of the discourse I see and a lot of the things I'm hearing about at this point in time are people being like, I'm fine with trans people doing what they want when they're an adult, and they can choose to alter their body, like that's just a human right, you know, people have access to that. But kids, I'm gonna tell you something, no kid should be transitioning. If any kid steps foot in a gender clinic, that's child abuse. So the idea for this video today is essentially going through and talking about what the experience was like. Thinking back on it now, I'm going to try to dissect what parts I think were appropriate, if there were any parts that I feel were inappropriate, what changes I might suggest in gender care, especially for children. I'm going to try to insert as much nuance as possible, but I'm going to come out right away and say that the arguments I have against accessing gender treatment as a child are not going to be very many. I had what I think is a positive experience overall, and although there were parts of the process that I wish were done differently, or there was extra consideration or care taken in certain steps, that doesn't mean like I'm fully against it. And as much as I'm going to try to add my nuance to this, I don't want the general message to be like both-sided, because I don't think it is. Honestly, like accessing gender care as a kid is such a minor part of my story. And being trans at this point in my life, I barely think about it. I'm going to be so honest with you. Like, I'm at a point in my transition where I'm comfortable, I'm living the way I want to live as the gender I want to be seen as. And that's all I could have asked for. That's literally it. I do also want to mention, I don't have a script for this video, but I do have notes, because otherwise my brain would just be scrambled eggs and I wouldn't make any point at all. But before we really dive into like the meat of the story, I'm going to give some quick background about myself and my early transition. So way back when I was just a wee small Trevor, I didn't really think about gender. To be quite honest, I did not think about gender. I think that goes for most kids. I hung out with the boys, I hung out with the girls when they were there, but mostly it was just me and a couple of buds. We were always outside doing shit. And so, you know, as a kid, you're just doing stuff. Gender doesn't really come into play that much. And because of the way I was raised sort of genderless, if we can even call it that. Really what my parents did is, all they said is you can play with whatever the hell you want, and that, like, they taught us that certain things don't have to have a gender, even though they might be marketed towards boys or marketed towards girls specifically. And right off the bat, I think this is a great parenting style. It actually gave me a lot less worry than I think a lot of trans kids go through, because I wasn't forced into any certain role by my family, in terms of gender, that is. I had more time to grow, express myself, find myself in who I am, and not based on a gender, but just based on my interests. And I'm going to be so honest, I liked playing with dolls. I liked playing with stuffed animals, but I also loved building Legos. I loved playing Bionicles. I mean, I was into everything. Everything, anything. I loved cooking. I loved cleaning, you know, emulating things that my parents did. This is all normal child stuff. I didn't realize I was trans, or there was something wrong with my gender identity, until I was like 11 or 12. And I think just at that age, puberty was starting to hit, like, I mean, for me, puberty had already kind of hit me pretty hard at that point. And I just felt uncomfortable. I started to realize there were some things I was uncomfortable with, especially the growth of my chest, um, the way it showed through shirts, the way people might have looked at me. And I think at that point I realized there was just something wrong. And so I kept picking at it a little bit, and I found online spaces where when I was looking up like, oh, why do I feel wrong? Why do I feel bad? And I started to get depressed during middle school as well, and it was just a lot of things coming together, and me trying to figure out who I was. And actually, the first time I came out, it was as gender fluid, and then I very shortly came out as bigender after that. And anyway, these two times that I came out, I just came out to my friend group. I didn't come out to my family. Just some really good friends I had at the time. I felt safe enough to disclose that, hey, I feel a little uncertain. I feel a little weird. I feel like there might be something going on with my gender. And luckily at the time, my friends, I wouldn't say they were supportive because they were really just dumb 12-year-olds, but they were as supportive as you could get for like really ignorant middle schoolers. As I went into online spaces more and I was kind of figuring out different queer labels and just learning about different identities, trans masc, trans men, they came up obviously. And I think over time I just started relating to that experience more and more. Um, Feeling like the masculine urges running through my body and all that shit. And at 13, I was so sure of myself that I came out to my family. I remember my coming out was like really, really low key. My parents were already pretty supportive. They were pretty like against parenting with those gender roles and stuff. So I was pretty confident at the time my parents were gonna be fine. They were gonna be accepting people. And they were. I literally just left them a little note with a trans flag on it. And it was basically like, "Hi, I'm trans." Um, and I actually felt like in the letter I was like, "I'm okay going slow. I don't need necessarily everything to change in a day. In fact, I think I would have freaked out if my parents started actually changing things in a day. I was anxious to come out, even though I felt like I would be supported. Um, there was still this unease. There was still this not knowing. There was a lot, and I needed someone to help work that through with me. Um, and that's part of the reason I came out. I just needed someone to talk to about it. I felt like this was so heavy. I was becoming depressed because of it. I needed someone to know that this was at least a contributing factor to why I was feeling the way I was. Before I even started to get into any medical transition side, the first thing most trans people do is they start to socially transition. Or at the very least, it's not even like a social transition. They start to explore options in which they can alleviate some dysphoria. For me, that was like asking for a binder. And thankfully, my parents were like, "Yeah, sure, we'll get a binder. Yeah, that's fine." Um, we went shopping for different sets of clothes that might make me feel more comfortable. Things that are always the first step in alleviating any discomfort possible. And I will tell you that even just dressing right, even just feeling okay in my own skin, like without any medical intervention, was an important step in my transition. If I wasn't allowed to just explore first, what is it like wearing boys' clothes? What's it like shopping in the boys' section? If I didn't do any of that, I don't think I would have understood my comfort level with transitioning. You're gonna have to really excuse me on any timeline here. I don't really have a timeline. And I'm gonna explain this really quick, but I don't have a great memory. I had an abusive childhood, and not in a sexual way. Most people think trans people always were like sexually abused, um, and that's just not the case. My stuff was very different. But anyway, it was chaotic, and so my memory of the time is not great. I was going through a lot mentally. It was very stressful, and my brain just kind of blocks it. Um, so unfortunately, I don't really know what it all looks like looking back. I can give you the overview of how I got into the gender clinic and all of that, but giving exact dates, I don't think I could do that. Something that helped me tremendously is that I was already in the medical system. Keep in mind, I had the arthritis and I was seeing other doctors for other things too. Generally, how those things work is like you have one condition, but you end up having to see like two at least subspecialties of doctors because, like, let's say you're on a drug for your arthritis, that might also affect your liver. This wasn't a true example for me, but let's say that were true. You might also need to see a gastroenterologist as well. That's just kind of how it happens. I was bounced around to different specialties at different points in time, with rheumatology being the main specialty I was seeing. But anyway, I was in the medical system with a hospital, and I was a registered patient already who was continuing to seek care. Now, the reason this is important is that it gets you in faster. Another thing that was also just luck-based is that within the very medical system I was already established in, within that very hospital, at that same location, not just the hospital group, but that specific location, there was a gender doctor there. The stars aligned, essentially. The reason that me being a patient first matters is because there's a difference. If you are going in to a hospital system as a returning patient or a new patient, getting in as a new patient is usually a much longer, a much more substantial process because you haven't been in that hospital system. You have to do so much more paperwork, and they're going to give first priority of appointments to people who are already a patient. This happened to work out really well for me. There was a gender doctor at the hospital I was already a registered patient at, and they were able to give me access to that much more easily than if I were to call a new hospital group, give them all my insurance information, ask what their wait list is. Like it was not the whole process. It was a little streamlined for me. When you go to the gender clinic as a child, they're not going to give you any shit like the first day, like period, any shit. I even went on a period blocker before I was on testosterone, and they didn't give that to me the first day. I mean, it's just a really heavy dose of a birth control to stop the period. And they said, we're not even giving you that. Like, the very first appointment is like the basic overview of who you are, why you're here, why do you think you're trans, and like, should we go forward? Should we move forward? One of the very first things I remember talking about in these appointments, really heavy stuff actually. They had asked about me like having mental health issues, like my experience with prior abuse. They asked me intimate details about pretty much any of my trauma. And basically they did that because they were trying to parse out if my trauma could in any way be leading me to be feeling trans without actually being trans. Now, I want to tell you, this part was actually terrifying for me. Not only is it scary to just rehash anything traumatic in your life, but also it's scary that if I had that trauma, I was thinking, what if this trauma excludes me from accessing this treatment, even though I don't think my trauma had any relation to my gender? It is terrifying to sit in that gender clinic office and for your own mental health struggles and for your own trauma to be brought up almost in a way to exclude you from getting the treatment. And I know there's reasons to do that. Believe me, I know the reason to do that. I'm just saying at the time it was also quite uncomfortable and quite scary because I did have a history of trauma. I think most trans people have some history of trauma. Doesn't matter what it is, but some degree. And it's terrifying to have to admit that you have that trauma. You're being honest and truthful that you have this trauma, but also knowing, like, at the same time, is this gonna disqualify me from being trans? So the next step in the gender clinic is to kind of go through what you need to get there. And first things first is to find a therapist. And not just any therapist, a therapist that specializes in sexuality and gender, typically someone who actually specializes in working with trans kids, because this person is going to need to be able to write a letter of recommendation for the child to start hormone replacement therapy, if that's the decided medical route to take. I had an established therapist. So I was already in the therapy system. I had a therapist, and transferring from one therapist to another is much easier than getting your first therapist. It's just a streamlined process. Usually your previous therapist can link you to other therapists in the area, and so you already have an inside man kind of working with you. And that's what happened with me. I was seeing one therapist, she was shit. Like, she was my first and worst therapist. Christ. Anyway, the second therapist who was working with me on gender stuff was a step above that. Still not the best therapist, to be honest. I'm not sure he deserves his position. That's another problem, though, and not something I blame the gender clinic for at all, because therapy is its own thing. Being a licensed mental health worker or licensed clinician is very different than actually being a medical doctor. And so when we talk about the therapy and we talk about the gender clinic, they are combined and those tools are used together. But I want to be clear that the therapy side is actually probably the shakiest for me because depending on your therapist, and some therapists are like actually just not very good at what they do, um, you could be stuck with a bad gender therapist. And that's not the gender clinic's fault. That's not the fault of the procedure. That is a fault with therapists just not jiving. And not jiving with your therapist is a major problem, especially if you're going to be using this therapist to access hormone replacement therapy. Thankfully, my therapist wasn't that bad. Honestly, he was bad for other reasons, like not really related to the trans stuff. He would just ask leading questions about self harm and stuff like that. And leading questions are like a big no no in therapy. So, this is probably going to be my first major complaint of the video. Therapists are not, I mean, they don't really have a governing body. They don't have a standard practice. Therapists are meant to kind of meet their patients where they're at mentally. And that's the beauty of therapy, but that's also the drawback. Not every therapist is suited for their patient. Not every therapist is suited to do therapy at all, quite frankly. And that is a major problem. I firmly believe that instead, these gender clinics that are already established in hospitals should have their own therapist that works with the doctor. The reason for this is I kind of want to cut out the middlemen of bad therapists. I don't want them meddling with something as serious as hormone replacement therapy. It worked out for me. My therapist wasn't that bad, but I do worry. I do worry about any old therapist who says they work with queer people to be able to write these letters of recommendation. And even if it doesn't end up being the wrong decision, I want to make sure trans kids have access to quality therapy. I want to make sure they have access to therapy that's well informed and working alongside the actual doctor in the gender clinic. That's what I want. I want to jump in quickly. This is after, this is like kind of post recording stuff, but I wanted to clarify that there is, I think, some importance to your gender doctor knowing and possibly having rapport with the therapist that you're working with. I think this is valuable. I honestly trusted my gender doctor way more than I trusted my therapist at the time. And I feel like I could trust my gender doctor to choose a therapist for me that would have accurately assessed what I needed in treatment. And that's kind of where I would actually hope a lot of collaborative effort would come in. The doctor and therapist can build trust between each other, and that way they know more accurately who they're treating and who they might not need to treat. Like, I don't know. I feel like there's a positive aspect for the patient having trust, knowing that their therapist is going to accurately assess their gender needs. There's also the benefit of the gender doctor and the therapist being in close proximity and in close contact and like being able to communicate things. Because I feel like therapy is a very crucial and important part in transition. Now, I was visiting the gender clinic probably like once every couple of months. After a few visits at the gender clinic is when we started really talking about what treatment looks like. All right, so we've got this baseline understanding. Who is this patient we're treating? Why are we treating this patient? Do we agree that this patient needs treatment? And essentially, once they gather enough information, they were like, okay, we'll get you on period blockers at the least. And even for period blockers, I needed one parent to sign off on that. And I needed the doctor to sign off on that. And I needed to sign off on that. I was on the period blockers alone a little bit before I started testosterone. I want to say I was able to start testosterone after like a year of being with the gender clinic. Maybe a little less than a year with being with the gender clinic. It was a much more strict process to sign off on the testosterone than it was to get the period blockers. I want that to be perfectly clear. The period blockers were a really high dose of a regular birth control that they give to women all the time. And I took a really high dose of that. It stopped my period. Fine. If I came off of that, it would have come back. The testosterone, I needed to have both of my parents sign off on that. I needed to have my doctor sign off on that. I needed a written letter from my therapist. I needed to sign off on that. And not to mention, this was all like reaffirmed after each appointment. Are you sure you want this? Before I even got on testosterone. And I was in this gender clinic for about a year, like I said, about a year. And so when people say that the process is too lax, I mean, I know I only have my experience, but the process really didn't feel lax. It really didn't. It felt like they were gonna strap a nuke to a child, and they needed to make sure that they knew which child they were strapping this nuke to. All right. But I want to say that this is not unique to the gender clinic. This is really not. I was in pediatric rheumatology. They take their patients' lives very, very seriously. Part of the treatment for rheumatoid arthritis, nowadays they have biologics, and those are specific drugs. They're very serious. They're typically injected or infused. Um, and I went on a couple of those to try. I was on a couple different arthritis medications. The biologics worked the best. And anyway, that stuff's no joke either. That stuff fucks with your body, like, really bad. It can make you immunocompromised, and more susceptible to getting sick and all of that. It's serious. It's very serious to have someone who already is young and doesn't have a fully developed immune system to get on this drug. And they take that decision seriously, like I would expect a doctor to. And the gender clinic takes their decision to put me on a serious drug, like I'd expect a doctor to. Honestly, sometimes, like, I felt the barrier to access the actual treatment for being trans was leaps and bounds harder to get past than the barrier for getting some of my arthritis medication, which were very serious. They caused a lot of changes in my body. I was on prednisone for a while when I was 8 years old. Like, I was on it for 2 years. That's a serious steroid, and they put an 8-year-old on that. And I certainly didn't spend a year at the rheumatologist before they decided to do that. Honestly, maybe I wish they would have. I maybe wish they would have taken some more caution with my body. I was so young. And I do have health repercussions from taking medications. My body doesn't function exactly the same. I wish some of my doctors cared enough, as my gender doctor did, to take the steps before diving into treatment. And honestly, I think that's why I came away with so little regret for it. I've come away with a lot of medical regret, unrelated to trans stuff, completely unrelated to trans stuff. I have come away regretful of putting drugs in my body. I have come away regretful of certain other treatments I've accessed. I've regretted going to doctor's appointments and stuff. Not to the gender clinic. They treated me kindly. They treated me with respect. They treated me like a patient that they truly, truly cared about. And I just can't say that about all of my doctors. I really can't say that all of my doctors treated me with as much safety and caution as my gender doc. I feel like now is a good time to get into my second huge gripe with the conversation around trans children. And that is that people seem to be under the belief that gender clinics don't operate under the same rules and regulations and guidelines that other doctors do. I said at the beginning, this clinic was in the same hospital that I went to see my rheumatologist. Same rules, same violations. I guess this kind of leads me into my next thought, which I think is important. It's that, like, people seem to be under the impression that the gender clinic is kind of like its own thing, and that they operate under their own rules and regulations. And that's not true. Gender clinics operate within hospitals that are already established. Now, I'm not sure this is true for every gender clinic. I'm sorry if it's not. Like, if you go to a specific gender clinic that is outside of a different hospital practice, this is just the way that it was for me, and that it seems to be for other people, at least in my state. This hospital was the same people I saw my rheumatologist at. Same rules and regulations apply to the rheumatologist, to the gastroenterologist, the urologist, the gender clinic. Everyone has to operate under the same health codes. the same standards of practice. I mean, they're supposed to. I know not every doctor does because doctors are human and fallible. But in theory, they follow the same rules and regulations. They should be held to the same standard, and they often are held to a higher standard because of the discourse surrounding trans kids. When I went to the gender clinic at 13, 14 years old, when I went to the gender clinic at 13 years old, I came in with a list of things I wanted. I mean, I wanted testosterone right off the bat. As soon as it could happen, I'm for it. Like, that was me. And I wanted to jump on things super fast. I was a little impatient about some of the process, and I complained here and there about, like, oh, it's taking so long, it's taking so long. They didn't just listen to me. Do you think they're crazy? I was 13, 14 years old. They're not going to listen to every word I say just because it makes me feel better. Like, please give me the testosterone now. I really want it. Do you think they're going to actually listen to that shit? They are grown adults, doctors, paid for their time. They take their job very seriously. And although they will listen to a 13, 14-year-old saying they are having mental distress, they're emotionally upset, they don't feel right as they are, in the body they are. They can see that, but they're still going to say, but we need to follow the rules and regulations. As much as I can see this is distressing you, and we want you to feel better, we just can't do that. Part of being a doctor is having to say no to your patients. Doctors say no to patients all the time. And to think that the gender clinic operates differently is very naive. These are doctors who know what they're doing. They know that they know what they're doing better than their patients. And so they don't always listen to their patients. I don't know why this needs to be said, but for some reason people think like when I was 14 years old, the doctors were just giving me everything I wanted anytime I asked, and that's not true. This is where I'm going to add another complaint into the section, all right? People love to talk about teenagers, so 13 plus year olds, as if they're like 4 fucking years old. We can agree that everyone under the age of 18 is a minor, and still recognize that 13, 14-year-olds are more cognitively aware than a 5-year-old. Like, I don't know, people were saying, like, how could a 14-year-old make that decision for his body? The thing is, I expect a 14-year-old, when they're telling me that, oh, their elbow hurts, or they're having a bad mental health day, like, they feel sad, I can trust that they're telling the truth about that. We have feelings, like from the day we're born, we have feelings, and we can tell in ourselves that things are right or wrong. And even if we don't know in exactly what way, we don't know how to help ourselves, we can feel when something's off. And to deny the 13, 14-year-old autonomy over their own feelings and emotions and distress is really fucking weird, if you ask me. Of course, I'm going to interact with a 5-year-old different than a 13-year-old. I'm going to interact with a 13-year-old different than a 25-year-old. But I am tired of erasing autonomy from patients who are under the age of 18. Because even if you are under the age of 18, I believe you have some sort of right to take hold of your health. Let's say you came from an abusive family, neglectful to the point where they didn't get you vaccinated, you've been underfed, maybe you're dehydrated, who knows what. I think if you are 14 years old, you can pretty firmly say, this is fucked up. I need to eat. I need to bathe. I need to do whatever. That's it. A 14-year-old knows that. And they should be able to seek options to get their health in order. Because as soon as you can know that something is wrong, which is from fucking zero, I feel like you should be able to verbalize your distress and for adults to take it seriously. People do not take children seriously. They don't take their emotions seriously. And I just don't know why. Children are people, fully formed people. Their brains aren't fully developed, but they're full people, full humans deserving of our respect. They deserve comfort as best we can provide it. And they certainly have some autonomy. They should. Because, yeah, maybe a 5-year-old shouldn't be able to take care of their own health. But if you're 13, why not? Why not? You are starting to become an older person, maturing, growing up, getting into the world. You are learning how to be self-sufficient, how to depend on yourself. It's critical that you learn to assess your own health, how you yourself are feeling, and to be able to take action for yourself to do that. That is such a valuable skill, and we should teach it to kids. Okay, I am coming back to this video like hours later in the day. It is now almost 6 p.m. Um, and I did edit some of the first part of the video earlier, but then I had an appointment, so I stopped the recording part, and anyway. This video is getting insanely long for what it is. It's just me sitting and rambling and chatting. But I think this actually made a little bit of sense, because this video will kind of serve as the insider look. What are the steps like? I'm kind of, by telling it all like this, it's very medicalized. And that's because it was extremely medicalized, my whole transition. For better or for worse, whatever your opinion on that is, that's what it was. And for people to, right now, be convinced that we're, transing the kids or something, it's some easy task to do that we're all, itching and, scrambling to do, please come back to Earth. If anything, this video should show you that dealing with this is just like dealing with any other health concern. You go to the same place, you do the same thing, you're talking to the same sort of people. There are more steps involved, there are more rigid guidelines, it's harder to get testosterone or other hormone replacement therapy than it is to get a different type of medication. But it's kind of just the same. And that will lead me into part 2, where I will discuss more about the emotional effect, my actual journey, my process, and how I feel about it. I want to be more intimate and open, and it's less medicalized in that aspect. Things like, do I regret any part of my transition? How far did I take it before I was over the age of 18? What was it like transitioning so young? These are things we don't often get a glimpse into, and something I wish I had when I was that age, because not many people are transitioning that young. Point blank period. Not many people are doing what I did. And if I can share my story to get out there that, hey, it's really not that interesting, to be quite honest. Getting this treatment, accessing it, the whole thing, the process is as boring as going to see your urologist. I promise. And it's daunting as much as dealing with any other health issue or dealing with the healthcare system itself can be. Here I am, once again on audio, because I forgot to film an outro, and I was supposed to do the things YouTubers are supposed to do, which is tell you to like and subscribe. Those things will help my channel. I've recently just wiped my past content because it was all stuff I made when I was a child, and not stuff I'm super proud of now, not stuff I want to be my quote-unquote brand, I guess. And of course, if you do decide that you liked this video enough to like and subscribe, don't forget to turn on notifications for the part 2 of this video. I think that one will be, honestly, a little bit more fun for me to make and talk about, because it's going to be good stuff. It's going to be things that I found really interesting about my transition in a more emotional way. So thank you so much for watching this. If you've made it this far, I really appreciate you, and I hope to see you in the next one.